Possible causes of wrist pain and treatment tips. Injury and certain health conditions, including arthritis, can cause your wrist to hurt. Symptoms like swelling or numbness can vary depending on the underlying cause. Wrist pain can be classified as any discomfort felt in the wrist. It can be caused by a variety of issues, including 1. Acute injury. 2. Arthritis. 3. Gout. 4. Carpal tunnel syndrome. Even though the wrist is a small part of the body, it's comprised of 8 bones, as well as ligaments and tendons, making it a somewhat delicate area. Causes of wrist pain. The following conditions are common causes of wrist pain. Carpal tunnel syndrome. The median nerve is one of the 3 major nerves in the forearm. Carpal tunnel syndrome occurs when the median nerve becomes compressed, or pinched. It's located on the palm side of your hand, providing sensation to the following parts of the hand. 1. Thumb. 2. Index finger. 3. Middle finger. 4. Part of the ring finger. The median nerve also provides the electrical impulse to the muscle leading to the thumb. Carpal tunnel syndrome can occur in one or both of your hands. Aside from causing wrist pain, carpal tunnel syndrome can lead to 1. Numbness. 2. Weakness. 3. Tingling on the side of your hand near the thumb. Risk factors for carpal tunnel syndrome include 1. Performing repetitive tasks with your hands, such as typing, drawing, or sewing. 2. Pregnancy. 3. Having certain medical conditions, such as diabetes, arthritis, or an underactive thyroid. 4. Having a family history of carpal tunnel, as anatomic differences can run in families. Wrist injury. An injury to your wrist can also cause pain. Falling and catching yourself with your hands is a common way to injure the area. Swelling, bruising, or disfigured joints near the wrist may be symptoms of a fracture, tendonitis, tendon, or ligament tear. It's also possible that the nerves or the tissue around the wrist can become injured, even if the bone is unharmed. Gout. Gout is a type of inflammatory arthritis that is typically caused trusted source by a buildup of uric acid. Uric acid is a chemical produced when your body breaks down foods that contain organic compounds called purines. Most uric acid is dissolved in the blood and removed from the body through urination. However, in some cases, the body produces too much uric acid, and in other cases, the body does not excrete uric acid sufficiently. This excess uric acid can be deposited in the joints, resulting in pain and swelling. Gout pain frequently occurs in the knees, ankles, wrists, and feet. Common risk factors for gout include trusted source. 1. Overconsuming alcohol. 2. Overconsuming foods and drinks high in fructose. 3. Eating a diet high in purine-rich foods, like red meat and certain types of seafood. 4. Living with obesity. 5. Certain medications, such as diuretics. 6. Other conditions, such as high blood pressure, diabetes, and kidney disease. Arthritis. Arthritis is an inflammation of the joints. The condition can cause swelling and stiffness in the affected body part. Arthritis has many causes, including normal wear and tear, aging, and overworking the hands. There are many forms of arthritis, but the most common types that can affect the wrist include 1. Rheumatoid arthritis, RA, is an autoimmune disease that can affect both wrists. 1. It develops when the immune system mistakenly attacks the lining of your joints, including your wrists. 1. This can cause painful swelling, which may eventually result in bone erosion. 2. Osteoarthritis, OA, is a degenerative joint disease that's common among older adults. 2. It is caused by a breakdown of the cartilage that covers the joints. 2. The protective tissue is damaged, during the aging process or over time, and repeated motion. 2. This increases the friction as the bones of the joint rub against each other, resulting in swelling and pain. While arthritis can happen to anyone, especially as we age, there are some risk factors that can increase your chances of developing it. According to the Centers for Disease Control and Prevention, these factors include trusted source. 1. Living with obesity. 2. Living with untreated infections. 3. Smoking. 4. Untreated joint injuries due to overuse, such as knee bending. Ganglion cysts. These benign, non-cancerous, and usually harmless lumps occur most often in the hand, usually on the back of the wrist. It's not known what causes ganglion cysts, but, according to the American Academy of Orthopedic Surgeons, they tend to appear most often in 1. Individuals ages 15 to 40 years. 2. Gymnasts, because of the repeated stress to their wrists. 3. Individuals assigned female at birth. Many times, ganglion cysts are painless, but if they're putting pressure on a joint or nerve, they can cause pain in the wrist area. Treatment for ganglion cysts varies from waiting to see if it will go away on its own, to wearing a splint, to draining it. Wrist tendinitis. A person's wrist contains many tendons. Together, they allow movement of the wrist, hand, and fingers. Wrist tendinitis refers to inflammation of a tendon within the wrist. This condition typically causes pain and swelling and may result in a reduced range of movement in the wrist. The following factors may cause or contribute to wrist tendinitis. 1. Age. 2. Poor posture in the wrists. 3. Poorly aligned joints. 4. An acute injury from a fall or other impact. 5. Diabetes. People can usually relieve the symptoms of tendinitis with minimal treatment, such as stretching, splinting, and icing. OTC medications can also help control pain and swelling. A person can take preventive steps to avoid wrist tendinitis. These include exercising the wrists and taking regular breaks from repetitive activities that may strain them. Kienbock's disease. A rare disease that causes the lunate bone in the wrist to slowly break down due to low blood supply. Kienbock's disease can cause 1. Wrist pain. 2. Swelling. 3. Decreased grip strength. It's not known what causes Kienbock's disease, and symptoms can range from mild to more severe. The condition can be treated with 1. Medication. 2. Splinting the area. 3. Surgery to increase blood flow to the area. Symptoms of wrist pain. Depending on what's causing your wrist pain, it may be accompanied by the following symptoms. 1. Swollen fingers. 2. Difficulty making a fist or gripping objects. 3. Numbness or tingling sensation in the hands. 4. Pain, numbness, or tingling that gets worse at night. 5. Sudden, sharp pain in the hand. 6. Swelling or redness around the wrist. 7. Warmth in a wrist joint.